Hey everyone, Dr. Eric here from MedBetterHealth. Have you ever wondered, listen, what's the best way for me to take steps not to have memory loss, not to have dementia? Well, if that's you, I've got a treat for you. On this show, I have the greatest of all time, the GOAT when it comes to memory care, cognitive care, Dr. James Galvin. And if you are wondering what preventive steps you can take, this show is for you. I know a lot of people are interested in hearing about that. But before that, a lot of the times I use this example with my team, with everybody. It's the story of the logs falling from a mountain, from a river. And these logs, they're falling down, and people are just cleaning those logs and cleaning those logs. But nobody asks the question, hey, we're cleaning all these logs. Where are they coming from, and who's throwing them, and how can we stop them from falling down so we don't have to clean them all day long? The reason I lead with that is because I want to talk about prevention. Mm-hmm. People always ask, well, what medications, Dr. Galvin, can I take so that my memory is good? What vitamins can I take? But besides that, are there any other things? And I'm a very big believer in that. We were created for a certain way as humans, eating natural food, exercising, walking. That's kind of like a creation. I'm here in this world and I'm going to do it. If I do something unnatural, it may take me off the spot, right? What prevention can people do to slow progression or to preserve their cognitive function? And if you can talk a little bit about the Pointer study as well, which the Alzheimer's Association led with.
Right. So, in 1735, Benjamin Franklin said an ounce of prevention is worth a pound of cure.
Right.
Now, he was talking about the placement of firehouses around, major cities because they kept burning down. But I think it's relevant for brain health as well. Mm-hmm. So, while, we have treatments available for Alzheimer's disease, I think the money is to try to prevent people from ever developing the disease, right? So if you could even just delay the onset of Alzheimer's disease by 5 years, you would cut the number of actual Alzheimer cases by 50%.
Wow.
Right? Because remember, this generally affects people that are older, right? So if you could live 5 more years with a healthy brain and never develop Alzheimer's disease, wouldn't you want that, right? And so there are a number of studies that try to identify things that are risk factors, right? And identify things that make us more resilient, that is, like able to fend off disease, right? So first is if you have any medical disease, you want to control that medical disease, right? You want to take care of that. Your diabetes, your heart disease, your cholesterol, you want to manage that correctly, right? If you don't do that, then you're setting yourself up for failure when it comes to like brain health, right? Then we want to look at the things that make our brain more resilient. And these are not new things. These are things that you've heard forever, right? Is, stay mentally active, physically fit, socially engaged, eat a healthy diet. A heart-healthy diet is a brain-healthy diet. But there are other things we can think about. So we want to practice mindfulness, right? So that's living in the moment, right? Being present in the world, not letting the weight of the world bear down on us, like having a positive outlook on things rather than a negative outlook on things. People who are mindful have a reduced risk for disease, right? We want to screen for things that we're not aware of. So hearing loss explains about 7% of the risk of Alzheimer's disease. Many people don't get their hearing checked. And even if they know they have a hearing problem, they don't wear their hearing aids. And so that puts them at a higher risk for developing disease. And then we want to practice sort of healthful behavioral habits, right? So, just like we tell our grandkids, wear your helmet before you ride your bike. I have grandkids. You probably don't have grandkids.
Not yet.
Right? I'm 20 years older than you are, right? So, wear your helmet, right? So these are the things that, protect us, right? They're common behaviors, but if we don't do these things, we put ourselves at much, much higher risk. And so I think it's very possible that we can prevent disease. And this is where the Pointer study came on. What they did was it was a clinical trial. So they took a group of people who did not have Alzheimer's disease, right?
I think it was like 2,000 people or so, right? It's a
And
large
so
number.
they broke them into 2 groups. One, they gave sort of self-guided information. So they gave information and people had to do things themselves. And then the other group had an intervention. The intervention was controlling their medical conditions, getting an exercise program, getting cognitive activities, and eating a healthy diet, right? And they were in an active trial. So they were being monitored for all these things. So they all got roughly the same intervention. Little tweaks from here to here, but roughly the same. And at the end of the day, what they looked at, there was a little bit of benefit. There was a little bit of gain from people being self-guided, but there was a much greater gain when things were more, actively intervention.
Like having a coach that
Having a coach.
kept you accountable and
Kept
said,
you
well, did you
accountable.
do this? How many cognitive exercises did you do today? Let's
Right.
see what your score was.
But also not let you, so that you didn't have to go find these things yourself, right? So like, well, what cognitive activity should I do, right? This was kind of prescribed. It was an intervention. And I think there's even greater potential now to take that and tailor it a little bit more, right? So that it becomes more personalized to you, right? So if you're already exercising, then getting the same amount of exercise isn't going to gain you anything else, right? So if you've never walked, you want to walk. But if you're already walking, well, what's the next thing you would do, right? If you've never read, you want to read. But if you're already reading, then join a book club, right? So it's how do we like raise it to the next power, right? And that's where it is, because if we take these interventions and we can tailor them a little bit, we can potentially get even a greater effect. But the point of this study was very, very important because, one, it confirmed another study that was done called the Fingers study that was done in Europe. And two is that it gave us a hint that these non-medicine approaches can be very, very powerful ways of affecting brain health.
Love it. Love it. Thank you for sharing that. Now, if you got value from this video, I want you to imagine a world where caring for your loved one with dementia doesn't mean doing it alone. Imagine a world where you can have someone to help you at home taking care of your loved one. And imagine a world where you have 24/7 access to support when you need it. Well, I got good news for you. You don't have to imagine it anymore. This is now a reality, and it is now covered by Medicare. If you're interested in learning more, very, very simple. I want you to look up over here. We have our link to our website. Visit our website, scan our QR code, look in the description for the link as well, and don't imagine anymore. This is now a reality.